Focus toxin which is causing connective tissue breakdown is hyaluronidase toxin. Next is non-motile Clostridium, that is perfringens. So it is non-motile. This is the example for capsulated Clostridium also. Perfringens. Pigment producing mycobacteria. It can be photochromogen or scotochromogen. Photochromogen example is Marinum, Kansasi and Simiae. Scotochromogen Scrofulosum schulzii. Enterobacteriaceae is catalase positive. Formation of NAPK from acetaminophen. So it is mediated from the major pathway of acetaminophen is glucuronidation, whereas minor pathway is CYP2E1, which is forming NAPK. So if this enzyme is induced more, that happens in acetaminophen toxicity, so that more NAPK, more hepatotoxicity. NAPK is a hepatotoxic metabolite. COMT inhibitor which is acting both peripheral and central, two actions, so toll cap on. Beta blocker which is metabolized by pseudocholinesterase, so that is having a very fast action also, and cholinesterase, so the name is clevidipine cholinesterase. Beta blocker with intrinsic sympathomimetic action is pindolol. Febuxostat needs LFT monitoring, which is causing blister, phenobarbital. Bambuterol is prodrug of terbutaline. Defense mechanism in OCD is RUI. RUI is one is reaction formation, undoing, isolation of affect. Sense of inflammatory with sense of unfamiliarity with familiar action is Jamaivu versus deja vu. Difference between projection, displacement, reaction formation. Projection means you have some feelings which you are projecting on others. Displacement, boss scolded you, now you scold your wife. So that is displacement. That is exerted by firstly A exert to B exerting to C. A exerting directly to B, then it is projection. Reaction formation means A has some maybe A loves B but B do not love, so A reacts such a way that opposite, like do not liking B. Actually he or she, like A or A have some feeling towards B but express in the opposite way. Difference between id and ego. Id is actually pleasure, ego is reality. In between you have superego. Next is evaluation of Cushing syndrome. So you can look for cortisol level. It can be in the urine cortisol, in the urine level, or you can look in the level in the midnight, and dexamethasone suppression. Whereas so that you can make a diagnosis of Cushing syndrome. Whereas to know whether it is ACTH dependent or independent, then only you look for serum ACTH. For diagnosis of Cushing syndrome, you do not want to look for ACTH. ACTH you are looking after the diagnosis of Cushing syndrome for looking whether it is ACTH dependent or ACTH independent. For that evaluation, you are looking for the plasma level of ACTH. Okay. Most common fistula in diverticulosis, so that is colovesical fistula to the bladder. Crossed diplopia. Crossed diplopia means it is a divergent squint. The next is inversion of foot. The ligament involved is, the mnemonic is TIC. TIC is talocalcaneal. Talocalcaneal. So I can give you a mnemonic. One is Lisfranc's ligament talonavicular. Chopard's ligament is calcaneonavicular and calcaneocuboid. Whereas talocalcaneal is involved in inversion of foot. Then next is depolarization of heart. What is the order? Septum, then inside to outside. Endocardium to epicardium. The same way relaxation is also occurring. Then transverse fracture that occurs, that is traumatic. Trauma to the nerve. Nerve injury in transverse, not longitudinal fracture. And this occurs where proximal to the geniculate ganglion of the facial nerve. Flood sign occurs in glomus tumor. Recession and resection. Resection means you're removing, you're shortening the length so that it gets strengthened, whereas recession means it is weakening. So weakening you will do in the antagonist muscle. Okay. Lecture versus workshop. So lecture means it is actually one way, so that is didactic communication. Whereas a workshop means you are speaking together, so it is a Socratic communication. Healthy school environment, you have to remember door and windows 25% of the surface area, and 40 how many students in the classroom, 100, whereas one latrine for 60 students, one urinal for 40 students. Malaria, the transmission is cyclopropagative. Index of obesity, you have Broca's, Lawrence, Broca's, Ponderal, corpulence. So important thing is height is not taken in corpulence index. Then symposium and seminar. Symposium is imposing, means you are giving the lecture. At last they are asking you the doubts, but there is no discussion involved. Seminar, there is a discussion involved. Inertization and encapsulation. Inertization means everything you are crushing, making a paste, that is for landfill, uniform filling of the land. Encapsulation means you are putting in a tank so that these things and rest your spaces you are filling with cement, that is encapsulation. Then literacy rate, crude literacy rate, you are looking for literacy that is above 7 years by total population, whereas in effective literacy rate you are looking effective, so that means only the population, you are not taking the entire population in the denominator, only the population above 7 years of age. Number of beds in PHC versus CHC. So in PHC around 2 to 4, in CHC 30 to 60. Emporiatrics versus ergonomics. Emporiatrics is travel medicine, ergonomics is occupational health. ESI Act, employee versus employer. Employee only 0.75, 3.25 is from employer. Major arterial cycle is at the root of iris. Incision length of phaco is around 3.2 mm. Vox triad. Vox triad is, so you have to remember six self incision cataract surgery. Here you have a self-sealing small incision cataract surgery, and there is self-sealing tunnel 5 mm. Okay. Then Vox triad is in angle closure glaucoma. It is having three things: glaucoma flucens, iris atrophy, and vertical mid-dilated pupil, which is non-reactive. Pharmacological test for suspected parasympathetic palsy. So pharmacological test, that is evaluation of anisocoria. So it can be either parasympathetic or sympathetic palsy. So if it is a sympathetic palsy, the pupil will be in the dilated position, whereas if it is a if it will be in the constricted position. So you can give cocaine and apraclonidine and it will be dilating. It may dilate, whereas if in case of a physiological problem, it will not be dilating. So you can evaluate that. It will be mostly dilating with this cocaine and apraclonidine. Now to evaluate preganglionic and postganglionic, you are giving amphetamine. So amphetamine, no, if there is no dilatation, then it is a postganglionic problem. No post. Now if it is a parasympathetic palsy, the pupil is in the dilated position. Now you have to give pilocarpine in a low dose, so that it will be responsive. If it is, then it is Addis tonic pupil. Now you give that is only 0.125%. Now you give some more dose, 1%, and in that case, so in a low dose, if it is responsive, Addis tonic pupil. If it is not responding, increase the dose around 1%, and then it is again dilating, then it is third nerve palsy. In all these cases, not at all dilating, pharmacological triasis. Next is most potent activator of naive T cell, dendritic mature dendritic cell. Transferable drug resistance and mutational drug resistance. Mutational drug resistance due to mutation, it is only for one drug like that. So you can overcome by giving combination. Whereas transferable, it is to multiple drugs. Even you give combination, there is no response. It is more severe. Staphylococcus do not have a capsule. Osteomalacia and phenytoin due to vitamin K and vitamin D deficiency both. Cephalosporin, which is suitable for anaerobes, is cefotetan. Beta blocker, which is having intrinsic sympathomimetic activity, is pindolone. Location of optic foramen. This is important. Optic foramen in lesser wing of sphenoid, whereas superior orbital fissure is at the junction of greater wing and lesser wing, formed by both. Whereas rose, that is rodendum ovale and spinosum, they are in the greater wing only, and lacerum, it is in both the sphenoid and also petrous part of temporal bone. Sensory supply of foot, you can see the calcaneal branch of tibia, and also majority in the hand, it is majority by median nerve, which is in the lateral side, but in the leg it is majority is in the medial 3.5, and that is supplied by which nerve? In the medial side, so definitely it's medial plantar nerve, and the rest small portion, that is lateral plantar nerve, and you have saphenous nerve and sural nerve on the sides. Now branches of maxillary artery. So firstly it is mainly to brain and to ear. So into ear, two tympanic and deep auricular artery, to the brain middle meningeal, accessory meningeal. Okay, then and also one is going to inferior alveolar. So next, secondly, it is for muscular branch, second part, and also that is pterygoid, temporal, masseter, and also you can have buccal artery. The next is about the terminal one is so you know first part gave inferior alveolar, so now it is giving superior alveolar. You go behind palatine, go behind pharynx, pharyngeal and infraorbital artery. Next is Chopard's ligament, that is calcaneo-cuboid, calcaneo-navicular, superficial relations of hyoglossus muscle. So above you have tongue, styloglossus. Below deep you have stylohyoid. Above you have nerves lingual and hypoglossal, whereas below you have glossopharyngeal nerve. Then the muscles above is MSD. MSD is mylohyoid. S for we told styloglossus, D for digastric, and also the ganglion. Okay, whereas the lingual artery and all, it is below, deep relation. Good outcome of multiple myeloma is cyclin D gene. So cyclin D in multiple myeloma and also in mantle cell lymphoma. Here you have a question, lymphomatoid polyposis, that is polyp is in GIT. We know mantle is involving GIT, so that is actually mantle cell lymphoma. Necrosis in pancreas is actually fat, saponification and all occurs, so that is fat necrosis. So in G6PD deficiency, what it is both intra and extra hemolysis, whereas hereditary spherocytosis only extravascular. Silent-Lewis and integrin. So in rolling is involving selectin and adhesion integrin, whereas selectin is present in where? So integrin, the Silent-Lewis X is present on that WBC. Selectin is on the endothelium, and integrin and ICAM. Integrin is present on the WBC, whereas ICAM is present on the endothelium. So you can remember C is there in both in endothelium parts, selectin and ICAM. Then catheter associated UTI. So catheter UTI means 10 raised to 3 is enough. Otherwise asymptomatic bacteriuria only 10 raised to 5. Envelope of dengue is derived from host cell. And what is coding for envelope in hepatitis B virus is HBC. So imagine envelope, you're putting a core, the core part is having the important thing, right? You're putting inside, that is the core. So envelope, it is formed from HBC, core antigen. And not a core function in Lewy body dementia, that is autonomic disturbance. It is there, but not a key feature. A key feature is like a cognitive dysfunction, visual hallucination, Parkinsonian features. And in Amsel's criteria, not a core feature is about the pH. It's not a key feature because it is common with the other one also, trichomonas also, alkaline pH. Other things like the clue cells, Swift test and all, yes, core feature. Age specific death rate means you are comparing two different age groups of the same population. So stay tuned for more data. Till then, bye.